Thank you very much. It's really a pleasure for me to be here at this meeting, and I'm just absolutely thrilled with the focus that you've had and the breadth and targeting an issue that is so important to so many Americans. And what I'll be talking about today is complementary and alternative medicine approaches to pain management in women. And the first thing I'd like to do is describe to you the way in which I conceptualize what we mean by complementary and alternative medicine. And it's a moving field, and there are other terms that are often used, and sometimes even preferred, like integrative medicine. But here we're talking about medical and healthcare practices that are outside the realm of conventional or Western or allopathic medicine. And much of the approaches that you've been hearing about so far in the meeting have focused on conventional medicine, though you've been hearing also of many of the speakers referring to these complementary and alternative approaches. Many of these also have yet to be validated by those randomized clinical trials that you've been hearing about. And so there's been a real interest because as I'll be telling you in a moment, this is a very interesting area. Their interest in the public in complementary and alternative medicine is really increasing, and yet we don't have to date the kind of years and years of science of randomized trials for, if you will, CAM or integrative medicine as we do for conventional medicine. The word complementary is used when these strategies, like acupuncture, like massage, when these are used in combination with or together with allopathic or Western or conventional medicine. And actually the majority of people who use CAM or integrative medicine use it in this way. Over 90% of the people combine these approaches with conventional medicine. In fact, many of you may do that. If you take any herbal supplements like ginkgo biloba or echinacea to prevent the onset of a cold, and you also see your regular family physician, primary physician for conventional medicine, you would be a person who's using complementary medicine. Alternative is when these strategies are used in place of conventional practice, and that's done less often, but also sometimes people elect to not pursue conventional medicine and to pursue these practices instead. Things can also be put in sequence. People might choose first, as in the lecture you just heard before, to use less invasive or complementary approaches first to see if they can manage pain. And then over time, if that doesn't work, begin to use more and more conventional medicine or add in the conventional medicine alongside with complementary medicine. The domains that I'll be talking about today, just to help us kind of get our hands around this, are really 5 major areas, and I'll go into these in more depth. One is biologically based practices, that includes diets, herbals. Mind-body medicine, you've been hearing about that already in this meeting. That's really where we're talking about meditation, yoga, some of the cognitive strategies of reframing, relaxation. Manipulative and body-based practices tend to include such things as massage, chiropractic, Pilates, where there's movement involved or manipulation of the body. And energy medicine, which is a little more controversial. This involves things like Qigong, Reiki, the concept of healing touch, where being with someone, and even if they aren't touching a person, sometimes there's been reports that the person receiving this healing touch energy, that's had some effects on pain. And then there are entire whole medical systems that are outside of our conventional medicine, like Ayurvedic medicine, traditional Tibetan medicine, traditional Chinese medicine, and these draw from the other 4 domains. For example, in traditional Chinese medicine, biologically based practices, they have herbs. For mind-body medicine, they talk about the qi. For manipulative, they do meditation and other forms of Tai Chi, and they think about qi as an energy source in the body. And I'll just point out that this is not that different from conventional medicine. Conventional, our medicine, many of us are familiar with, also draws from these 4 areas. Many of our drugs are biologically based. We see psychotherapists, we go for physical therapy, and we have EKGs and EEGs and fMRIs to look at electrical fields and better diagnose and at times treat us with various kinds of energy. So it's not that different. And what I'm really talking about is a continuum of things that are less well understood or come from other traditions and the tradition that we have. And we'll go into more of this. And why are people interested? What's drawn people to complementary and alternative medicine? First of all, the failure to yield cures. We don't have a cure for fibromyalgia. We don't have cures for all sorts of pain. Then there are adverse effects of some of the conventional medicines, side effects, the concerns that you've heard mentioned about Vioxx, for example. Another thing that draws people to CAM is that many of our primary care physicians, the way our healthcare system is set up, they don't have the time to sit for a long time and get the full medical history, to hear all of what you as a patient might want to say about pain. And it's that lack of time. Many primary practitioners would like to have that time, but our reimbursement schedules are not set up that they can do that at this time. And then we have another problem, and that's that many of you who have patients, or if you are a patient, most of us have at times been patients, we find we have fragmented care. We're seeing one person for this part of our body and another person for this problem. One person's taking care of our heart, someone else is looking after our kidneys or our gynecological issues, and they often don't talk to one another. And so we're the only people that are trying to keep all of this straight as we get prescribed more and more things from practitioners. And so that's been a concern to people. Particularly as you age, you'll find that you have polypharmacy, people taking many drugs and seeing many, many different practitioners. And no one's having case conferences where they all get together. There are also, if you will, there's things that are pushing people toward complementary medicine, and then there's something that kind of pulls them in that direction. And one is that the belief that many of these treatments are more natural. And sometimes that's not always the case. Many of our traditional, conventional medicines are also, Western medicines are also derived from natural products. But there is this belief that this is more natural. There's a focus in CAM, complementary medicine, integrative medicine, on patient empowerment, where the patient is often given the choices, the control is really imparted to the patient, or there's a closer partnership, and many people find that rewarding. There's also a focus on optimizing health and emotional well-being. Complementary alternative medicine therapists will often talk about mind, body, healing. The word healing comes into play. I work at the National Institutes of Health, and I often feel like it's not the National Institutes of Health or Healing, which is what it should be, but it's the National Institutes of Disease. In fact, I sometimes feel like my colleagues are hoping people get sick so they can then work on them to cure them. And that's sort of reversed from what I think we should be doing, which is focusing on the whole body, working together to try to promote resilience, health, well-being, quality of life. And that's more of the tradition in integrative medicine. I don't want to say, too, that I know all of us know primary care physicians that do all of this as well. So I'm if you will, pushing for some distinctions here, but many of us have clinicians who are very, very empowering and who do care about our mind and our body and our emotional well-being. But the other thing that we do find is that many CAM practitioners schedule their appointments so they have the time. They have the time to talk. They also touch their patients. They give them time and a closeness that's really important to people. And this push-pull is bringing more and more Americans to complementary medicine. We did a survey in 2002. We're going to repeat it in 2005. And when I say we, I'm talking from my center, which is the National Center for Complementary and Alternative Medicine. This was a random sample of Americans, 31,000 adults. These were actual person-to-person interviews that were done in conjunction with the Centers for Disease Control. And they asked these adults whether or not they'd used any of these various interventions, and they had a long list, in the last 12 months, and they included in that list the word prayer, praying for health or praying for someone else's health. And when they include prayer in the definition, and many people will debate whether or not it should be, but it's interesting to note that 62% of Americans, if you include prayer, said that they had used some sort of complementary and alternative medicine in the last 12 months. If you exclude prayer, 36%, over 1/3 of Americans have done something in complementary and alternative medicine in the last 12 months. And if you look at the coasts, like California, Oregon, Washington, or the eastern coast, the Northeast, you find that those numbers are much, much higher, over 50%. So it's nationwide, particularly a little bit more on the coasts, which tend to be where innovations are picked up. You're probably wondering what were the most common. Natural products was the most common thing that people reported doing. But they also reported 12% said that they had been doing some sort of deep breathing, which is part of meditation, it's part of yoga. It's what Superman told Lois to do. He said, breathe, Lois, breathe. I always think of that when I'm doing my breathing exercises. Meditation, very, very practiced by 8%, as many people practice chiropractic. Notice that these first practices are things people can do on their own. They can go to Whole Foods or Long's Drugs and buy natural products. They can learn meditation, sometimes even by watching a really good program on television. Some of us will still remember the Bill Moyers special that was many years ago. And you can also just learn this often from friends or picking up a book at Barnes & Noble. Chiropractic is something you have to go to someone to do, and so it's really impressive. And often people, though increasingly insurance is covering it, many people pay for that out of pocket. And then you move here down to massage and diet-based therapies. If we look just at the natural products, it's interesting to note that echinacea is the #1 seller, if you will, of CAM. But down the road, you'll see on the list glucosamine chondroitin, and in a moment I'll talk about how effective we found that to be in some of our randomized trials. And we're studying all of these various supplements at NCAM so that we can tell you what's safe, what's effective, for who and under what conditions. Interesting, fish oils is also used for a number of different health problems and to promote health, and that also is in some cases thought to be effective for pain. Now when we think about alternative medicine, anecdotes abound. We have wonderful examples, and people will come to me and tell me of remarkable things that they've experienced or that they've seen their friends experience. And these are very important because most of our healing, most of our medicine comes from someone sometime noticing something. And then beginning to study it and then to make a discovery. In fact, I actually point out to most of my colleagues at NIH that very few scientific discoveries came from having a specific hypothesis and doing a study and then finding that indeed that worked that well. Most of our ideas are things that come to us by chance. And so what we're doing at NIH is we're putting the money out there, we're keeping the labs going, hoping that people will use their peripheral vision to notice a side effect that might be effective as a treatment, or notice something else, because that's really how most science advances. And it comes from that individual case where someone will say, I noticed that this happened when I did this. Minoxidil, a treatment for hair loss for men, was actually a blood pressure medication. They found that when they gave it for blood pressure, it wasn't so great for blood pressure, but when people took this, their hair grew. And so Upjohn then marketed it for hair loss. This is how science goes. So your observations, your discoveries are as important as others, but the problem is anecdotes do not create evidence. We need to collect those, we learn from them, we puzzle about them, but we need research on what's safe. And there are certain food supplements like ephedra. Actually, if taken as it's supposed to be taken, ephedra is not dangerous. But what we found was that young people were taking massive doses of it in order to enhance their physical performance in sports. And so in that case, it became dangerous, and so it actually was removed from the market. We need to know what is safe, what's effective, and then we're particularly interested in trying to discover why, how. How is it that some of these various interventions work? And that's really the work of the National Center. In 1999, under congressional mandate, it was really congressional pressure from senators who were very interested in these approaches, who kept asking the National Institutes of Health, well, what do you know about bee pollen? And what about garlic? And the NIH director would sit there and say, well, that's really outside of what we tend to study. And so it was under congressional mandate that they said, we want you to study this. And they started the National Center for Complementary and Alternative Medicine and actually selected someone from NIH who was one of their intramural investigators, Dr. Stephen Strauss, to be the first director of the center, and he's the director for whom I work. And so this center has its mission to invest in research in these complementary and alternative practices, to train CAM practitioners, the practitioners in these areas, to be able to do research on massage, on chiropractic, and to integrate and develop teams of CAM researchers and conventional researchers working together. We have to train conventional researchers on how to do sham acupuncture or placebo acupuncture. So many of our grants are these partnerships between CAM investigators and conventional investigators. Like Dr. Bruce Rosen, who's the head of radiology at Harvard, is working with Kathleen Hoyt, a 70-some-year-old acupuncturist, and they're studying the neurobiology of acupuncture using fMRI. And I will be showing you one of Kathleen's slides later, and Dr.